Welcome. I'm Katherine Ambrose, and this is Empowering Seniors, the web series. I'm here with Mark Landwehr with LT Care Solutions, and we are going to discuss the pandemic and how that's impacting certain jobs and all of the Medicare questions and health insurance questions that are related to those changes. Welcome, Mark. Thank you so much for being here today.
Thank you, Katherine, for having us here. We're getting a lot of questions regarding this.
So tell us a little bit about what kind of job changes you're hearing about.
Well, we're coming across a lot of folks that are either being furloughed or they're being laid off. I from friends to clients and one of their biggest concerns are now, well, if my health insurance is going to end here in the next 30 or maybe 60 days, well, what do I do? Am I Medicare eligible? How do I navigate that? So those are a lot of the questions we're running into as all these job markets continue to change here.
So you had mentioned to me the other day too that some people are just opting maybe to retire.
Right, because they're saying, well, if I'm 67, 68, or even 70 years for a little while longer, but at this point, with a layoff or the uncertainty of how long this might last, they're saying, well, I'd rather just go ahead. I might just need to retire at this point, which means I am going to have to find new health insurance, and I'm going to have to now navigate the Medicare maze. So they're saying, well, why not just get it done now? Because we don't know how long we're going to have to continue in this other situation.
So what are the big questions that you're hearing from people?
Sure. They're saying, well, Mark, first off, what do I have to do? Who do I need to talk to? And when can I do it? Because when we start talking about Medicare, there's certain time periods that you have to do and use special election periods if you're over age 65 and you're losing a group health insurance plan. Well, a lot of those folks really have about a 2-month window to get Medicare signed up and get their whatever insurance, whether it's going to be a Medicare supplement and a drug plan, or if they're going to get a Medicare Advantage plan in the area. They've got a couple of months, so that's a pretty short window to get some of that stuff done. So that's a lot of what we're figuring is how long, who, where do I go, and thankfully that's what we're here to help them with those answers.
It sounds like it'd be really overwhelming, especially to work through some of those things on your own. So how do people even know to reach you?
Well, really word of mouth is one of the biggest things. We do run across a lot of folks that just don't even know that there's independent agents like myself out there. And they're figuring, well, where would I start? Some of them may go to an extension office where they're trying to get some questions answered and get some advice, but really they're not able to give them advice. They're not supposed to give them advice. And then they go, well, now I got more questions than I had before because, well, there's a lot for them to navigate. So, we have our social media page and the Empower series has been fantastic getting that information out to people going, hey, these types of professionals are available out here. So those are really some of the big ones. And we try to do Medicare 101 workshops every single month. So hopefully when this gets done, we'll have some of those in-person workshops again, but we do those monthly. So that way people can learn how to navigate this deal on an educational background versus, hey, what product can we sell you? Well, we're independent on that too. So we can help them a lot of the time on 101 workshops, or even we're going to have some web series like what you're doing here as well. So you're leading edge here, Katherine.
So Medicare 101, the workshops that you do, how many hours are those to really just kind of introduce people to that topic?
Sure. What we typically do, those are going to be about a 45-minute to an hour-long session. We're not trying to just bore someone on it because there is a lot to navigate. We're able to give them a really good view of what to do on Medicare and what time periods they've got to do it. But then after that, we're able to do individual one-on-one sessions for them, because now if you can understand the Medicare side, what is A, B, C, and D, what are some of those portions, then you're able to actually individually talk about the actual insurance. because it's very, very specific to each individual. A husband and a wife may not necessarily get the same type of insurance because they're just going to have different needs and utilize their health care a little bit different.
So, what kind of choices are people making right now? What are some of the ways that they're bridging the gap?
Well, right now, some of them are using Cobra currently as they're trying to navigate and decide how long am I going to maintain this insurance? Am I going to keep working? Am I waiting this out to see if I'm going to be going back to work? Some are just saying, well, even if I go back to work, if I just go ahead and transition to Medicare, there's a lot of really good options anyway, and it takes a little bit of that uncertainty out for them. So what we're finding, some are doing that if they are Medicare eligible, they're just taking the stress off. They're saying, I know if I just go ahead and get the Medicare side done, whether this lasts 2 months, 6 months, 12 months, whatever it may be, and hopefully less, right? Hopefully we're in the shorter numbers on that.
Yeah.
They're saying if I've just navigated the Medicare maze and I've got a professional that can help me do it, well, let's just get it done. We can do a lot of this stuff over the phone. We actually have our own comparison and enrollment website at ltcares.com. So a lot of people are able to navigate some of that stuff. We can do it over the phone, and they're able to enroll themselves in that regard. So we've simplified a pretty complex issue there, and they just feel really comfortable at this point going, well, even if they don't take me back, I've got my insurance side handled. And even if they do take us back and I get back to work, I still have my insurance handled, whether I'm taking their group plan or not. So some of that's taken stress off, which I think we all have enough stress going on right now.
Absolutely. So how long does it take to navigate the Medicare maze? How long does it take to get this sorted out?
Well, you typically, if someone's already past the age of 65, say they're 67 or 68, they really have about a 2-month window to get things done. But some of that also will depend on how long is their group health insurance going to last. Well, if their health insurance is only going to be good for, say, we're at the end of March and it's only good through April, well, they've got about April. They've got about 30 days to get everything said and done. So I'm not a very high pressure guy, but Medicare only moves so fast, and that really just shrinks their own window because this is a crisis kind of a situation.
Mm-hmm.
But we're able to get them whatever specific documents they need. We can get them directed to who they need to do. And we're seeing Medicare's still been turning around some of their enrollments in about 3 to 4 weeks. So in a lot of cases, we're able to get that done. And I would suggest any of the viewers, if you're thinking about the Medicare side, they should get a login set up with the Social Security Administration and Medicare.gov. So it's SSA.gov and Medicare.gov, because by doing that, if you get your enrollment set up, you're able to log into the Social Security website and see, have they got you active or not? Because you may not want to be waiting for the actual card to come in the mail, postal mail, because that could potentially be after you wanted your insurance effective. So you can get some of that information straight off of there. You can even print your Medicare card from there and have it a lot quicker than waiting for the mail to get here.
Okay. Do you think that Medicare will streamline some of these processes or be able to due to the crisis?
Well, they've opened some special election periods currently, so they've made some modifications if someone wasn't sure that they had an election period or this is affecting them, and they've actually made that special election extend to all 50 states. So in all areas, all counties, there's some special elections to extend some of these time periods if they had an election period and they weren't sure how long. But even with those election periods, the main issue is people don't want that gap. They don't want to lose that group and then have a day or a week or anything. Mm-hmm. Although their coverage is still going to be good on the Medicare side, and a lot of the insurance companies will waive either deductibles or co-pays or co-insurance. They still just you still get stuck kind of in that, I don't want to have a day or a week go by with any sort of lapse or a gap in coverage there.
And so if they're looking at the group insurance deadline, they can do Cobra. Explain what Cobra is, and are there any other options if they need to close the gap a little bit?
Sure. Cobra is an option where in a sense you're going to be paying what your share of the premium, but you're also in a sense to start paying what the group employer was paying for you as well. So that becomes one insurance option. It's an expensive option because, well, you're paying a full boat for it. However, if you go and look out on some of the marketplace, and I don't specialize in the non-Medicare side, but I do know when shopping, like even for my own family or even my parents before they could come on to the Medicare side, it can get pretty darned expensive if you don't qualify for any of the subsidies through the marketplace or exchange. So some of that, a lot of the time, I was just talking to a friend of mine the other day, 62 years old, worried about pre-existing conditions, which you don't have those questions in the marketplace. So that's one thing that he was able to ease her mind.
Okay.
But when we were talking about some of the prices, just helping a friend out, that was not easing her mind.
Yeah.
Because for a 62-year-old, you can be looking at 700 to 900 or even more in premium dollars. Well, that's not very cost effective when you're saying, I just got laid off. What am I going to do? But Cobra, in a lot of cases, especially for this short window, I'm going to find those to be better option when you don't have Medicare as an option. If someone has Medicare, a lot of them are saying, well, Cobra is definitely not as good option because, well, just the Part B premium, they'd pay $144.60 a month. And that gives them Parts A and Part B. So now they're in better shape versus spending maybe $400 to $600 or $700 for their Cobra. So we're able to, Medicare still becomes even a good segue option versus Cobra or even going out and buying traditional health insurance.
Okay. So now, do you help people with traditional health insurance?
I don't. I used to do a little bit to help my clients segue onto Medicare, but when the new rules came out for the non-Medicare insurance, I had to say I'm a specialist. You can only know so much, and we wanted to make sure we continued our focus on how does Medicare work because it's an ever-changing. Rules are always changing on that, and if we took our focus off of there, so we really just couldn't really continue some of the other as all those rules change. It was just almost too much to know, if you will, and still be able to be a specialist in our field.
And there's probably not that many specialists in any given area, I'm guessing, I know you are out educating and going to companies all the time, and it's very complicated. So for people that don't know, what does that mean, Medicare Part A and Part B?
Sure. So Medicare Part A, there's four parts all in all for Medicare. Medicare Part A is what's going to cover the hospital side. Medicare Part B is more of your day-to-day doctor's visits. So a lot of the time that's what they're going to use the most. So Part A, you wouldn't have a premium. In most cases, most will not have any sort of premium for Medicare Part A.
Okay.
Part B, however, the standard premium for that is going to be $144.60 a month.
Okay.
So when someone says, hey, I've got original Medicare, that's actually what they're talking about, Part A and Part B. That's what's considered original Medicare. And at that point, that's when what we call the 80-20 split comes in. With A and B, in a sense, Medicare's on the hook for 80% of the bill, and then you would be on the hook for the other 20%.
Okay.
And then folks, so what most are concerned with, well, hey, Mark, how do I cover my 20%? I got the 80 done. How do I cover my 20%? And that's obviously what we want to worry about. Well, what's going to be coming out of your pocket? That's definitely the focus. So then with that, we've kind of got it broke down to option one, and option two is, someone could go with a Medicare supplement or Medigap plan to cover that 20%, or someone could purchase or someone could get a Medicare Advantage plan. Those are really options there. And when someone talks about the third part in Medicare, which is Part C, that's a Medicare Advantage plan. There's lots of different companies, like in just our local Wichita area or Sedgwick County area, there's about 27 of those Advantage plans to look at.
Okay.
So that's why having someone, help you navigate, you're not only just navigating Medicare, as an independent agent myself, we're also navigating all the rest of that as well. So we're
Okay.
navigating the different companies and insurance options. And then the fourth part of Medicare is Part D. So D for drugs. I guess they got that lucky for
Okay.
prescriptions.
Yeah.
And that's the side that obviously you're going to be using for any of your pharmacy or, you know, any of your, for diabetics or for those taking blood pressure medications. So those are your four parts of Medicare.
Okay. That I'm learning a lot from this. You know, I've been doing the Empowered Senior Series for about 15 months, and I did a lot of homework prior to that, and then the TV show for a year. And this is still like clear as mud to me. So, um, anyway, believe me, I think going to professional to get help makes all the difference in the world. And you know, my real work is real estate, and I can tell
Sure.
you that real estate is very complicated, and it's good to use somebody very experienced to help you with that. Um, I am sending a quick message because I have some noise in the background, so I'm asking for some help. Okay, sorry about that.
No
So,
problem.
um, what are some of the questions that people should ask you when they first reach out?
Well, some of that, it's tough to know, well, what question would they be asking? But some of the kind of the things that we're going to go through are, well, how do you utilize healthcare now? You know, we don't have a crystal ball, right? But you have some that say, well, my health considerations, Mark, I know I'm going to have to go see the doctor X times a year. And they already kind of have that crystal ball. They know they're going to get this stress test done, or they know as a diabetic, they're going to get more lab work done and things of that accord.
Hmm.
Some of the big ones we're looking at is you really want to analyze your prescriptions. We find most healthcare costs come into the cost of prescription and your pharmacy benefits more so than seeing the doctor. His average is you see a doctor less than 6 times a year, but how many times do we go to the pharmacy? Well, every month, right? Oh, did I lose
No,
you
I had
there,
the sound off for just a
Catherine?
second. Okay, are you there? Okay,
No problem.
yeah,
Yep,
I've
I'm
got
here.
noise going on in the background. Um, do people have to worry about getting kicked off of plans, getting kicked off of any of these Medicare supplemental plans?
Well, they're guaranteed renewable. So as long as you're paying your premium, if you've got a premium, like on Medicare supplements, those will typically have a monthly premium, and then you'd have a Part D drug plan. So a Medicare supplement plus a Part D drug plan would be what I call option one. And at that point, as long as you've paid your monthly premium, and most would set it up to be paid out of their checking account. So, you know, probably a better way so you don't accidentally have something like that happen to where you didn't get something paid. You know, and we've seen it to where, you know, if someone was paying maybe on an annual and they wanted to write that check, but then they had a hospital stay.
Mm-hmm.
Well, you're in the hospital, you're not getting those bills, you're not getting that mail coming in.
Uh-huh.
That can in the end be a tough situation. You still have some leniency on that, but then you got to get out of the hospital and perhaps now you're trying to navigate what bills came in, what did I pay, what did I not pay, and it's really tough to navigate that when you're trying to heal. You know, you're more focused on healing. So we typically would have something set up as an automatic draft so you don't run into that situation.
Mm-hmm.
But they couldn't just kick you off for that, or they couldn't just kick you off of your plan because you had high claims or something. So you don't have to worry about that coming around. Well, oh gosh, this person's had 4 hospital stays in a year. We don't want them on the plan. You're not going to run into a situation like that. That would be against the rules, if you will. And then the Medicare Advantage plans, well, a lot of the plans in our areas don't actually have a premium. You just pay a copay as those come in. And if someone has a claims issue or they're worried about, you know, how is this going to work, or what kind of copay, what's going to be the cost of it. Well, what we'll do at that point is we'll actually help them review the claim. We'll actually take care of some of that stuff, which that also, as you might imagine, that's a difference between either having an agent or not having an agent. Because when you've got someone to call and ask that question of, Mark, hey, I've got a surgery coming up, or Mark, I got these weird bills in from the doctor's office. If all you have is 1-800 somebody, that's a tough call to make, right? We've all been stuck on customer service lines for hours, and then we get
Nightmare.
kicked around 4 different times. And
Mhm.
when you've got someone like, we've got about 5 or 6 different agents just in the local Wichita area, it really helps you get through a potential claims issue on whether prescriptions. We've even got a couple of pharmacists that are agents. So we bring a lot of knowledge. So as a team that we've built here, we're able to really utilize a lot of different professionals in our area, like yourself. If we've got real estate questions, guess what? I've got a phone number.
Yeah, thank you. It helps to have somebody that's got your answers and that can just streamline it for you, because to
Right.
me, there's nothing worse of sitting on hold or getting bounced around from state to state, because sometimes when you're on those 1-800 calls, like, we do all kinds of mortgage issues, help people sort through that, and we might be
Mhm.
talking to just people in all different states and there's no cohesiveness. So I don't know if that happens in your world, but
Sure, and then you bounced around 4 different transfers, and now you've told your same story 4 or 5 different times. People have to keep pulling your file up. So what we do a lot of times with our clients is we do a 3-way phone call with our client, so they're not having to get bounced around alone out there.
Mhm.
And because we know the lingo, just like yourself, you're going to ask more pointed questions the same way we're going to do. If we're calling in on a claim, we typically have our clients set up an online account with whatever insurance company they've got. And then we can see all the claims really easily that way. And doing like the technology that we're using now,
Mhm.
well, we can see what claims they have. So when we get on the phone with somebody, we're not having to worry about, well, which data service. We've got everything at our fingertips. So it helps us, because then they've got a professional that's able to really, really help direct the call, because
Mhm.
we don't like getting bounced around either.
Well, that's exactly what I was thinking, is that you've got a professional on the phone that is an advocate for you, because if you're hearing something that's right or not right, and you have a level of
Right.
expectation on how calls should go, how your client should be treated. And so if you've got someone on the phone that is maybe taking you off in the wrong direction, you're alerted to it and you know what to do. And so you know when to escalate it and go up the chain or whatever you might have to do. I'm just kind of supposing, but surmising, I guess. But I would imagine that would just help tremendously.
Well, and it really does. I just had someone I was talking with on Friday. He had called me, and he was just, Mark, I've called in. He wasn't a client of mine. He just had heard about us through a friend and said, hey, maybe you should call Mark. Maybe he can help out. Well, by the time we were done, I got on the phone with him, and he said, Mark, I've already spent 32 hours on the phone trying to get this stuff solved.
Oh
Well,
my.
we had about an hour and a half long phone call, but we had gotten his online presence made on, so we could see all of his claims. And by the time we were done, we had everything getting reviewed. We had their claims department sending out notes to actual local doctors' offices to get those solved. So we're going to have his stuff solved where he had already been 32 hours in. We were able to do it in about an hour and a half, and I imagine we'll have another call to finalize everything. But we were able to really get everything taken care of in a much shorter time, because I was able to do a lot of the talking for him, because I knew how the claims should work, and I already saw problems with the claims before we ever got on the phone. So we're able to minimize a lot of that. And that's just experience. You can't buy experience. You can only live it.
Right. That's true. So do you charge for that different assistance when it's needed?
Nope, there are no fees, no costs on any of that. That we get paid, but if someone's one of our clients, whatever insurance company they went with. So as independent agents, we're not locked into one company or another. Really, we're not married to one of them. We say, well, whichever is a better fit for you, we'll go that route. But there's no fees, and that's one of the things we pride ourselves on, is service. So it's not just, hey, I got you on a policy, and I'll talk to you 5 years later. We talk to our clients every single year. We annually review all of our clients' policies And if they've got a question, they're going to have access to us year round. And there's no charge to do that. We want to make sure we're here for when you need us, not just, when we got you on a policy. It's
Right.
not just 1-800 somebody. It's someone that knows your situation.
Mhm.
We've had those discussions, and it's really interesting because they've seen my families grow. And, you do this for long enough. I've seen them have new grandkids, and, their families have grown. And you really get to know your client in a situation of what's going on. And, even when it comes to the tough situations where we get the phone call of, if someone's battling a specific illness, I mean, you feel for them just as much, but we get the comment, hey, Mark, we're glad you're there for us in this time of need, because I know we've been with you for 6 years and really we didn't have much going on, which was a blessing.
Mhm.
But they'll say also now something is going on, Mark, and we're really glad to have you there in our corner when we need you. So we pride ourselves of being there when you need us.
Well, that's a tremendous service. So your company is LT Care Solutions. So you
That's
help people
correct.
with the Medicare. You
Mm-hmm.
also do a lot with veterans. That's primarily how I've known you, is
Yeah.
the go-to person when it comes to uncovering what veteran benefits are out there that people might be missing out on, and just helping get them to somebody that can help them with all
Yeah.
VA questions.
Yeah.
And then long-term care, where I guess
Mm-hmm.
that's where your name came from, long-term care
Yeah.
solutions. So long-term care. And this call is about Medicare, but real quickly, just tell us a little bit about your specialty with veterans. I think that's really important, because I
Yeah.
know for a fact that people miss out on a lot of their benefits because they're not aware, or they've just called, I don't know, the VA's office, or I don't know, they called somewhere and they didn't get the correct information.
Right. Yeah, and we've been working with veterans. There's a long-term care benefit that helps a lot of veterans, that if they're going to end up needing some home care, or if they're going to need some assisted living, and most claims, frankly, aren't at nursing homes, but most really come down to home care. They could be independent living with home care. Well, there's a long-term care benefit through the VA that, in case it's knowing how to navigate the VA, and in some cases there's some planning that needs to be done up front, so that way you're going to file your case correctly. But it could actually help them up to a couple $1,000s, or over $28,000 a year tax-free, to help a couple, a wartime veteran, actually help pay for his or his wife's care when they're needing it. So we've helped veterans for many years get that benefit through the VA, because we focus on Medicare and the long-term care realm. Well, those two always talk to each other, because Medicare is that short-term care, right? It's the day-to-day doctor's visits, it's the as-I-go visits, and then long-term care being, well, that's the stage that Medicare doesn't pay for. So we specialize knowing, well, how does Medicare pay in that situation, as well as what benefits, whether it be long-term care insurance that someone purchased, or if you're a veteran, we're a wartime veteran, or the surviving spouse of a wartime veteran, because a lot of people don't understand that, well, there are a lot of benefits for the surviving spouse, and a lot of them don't even try this. Well, he was the veteran, or she was the veteran, even, because we work with a lot of waves and WACs that served in the military as well. And they think, well, my spouse, they were the veteran. And in some cases, like my grandmother, my grandfather had been passed away for 14 years when we got this long-term care benefit for her, and she got it for 4.5 years. Well, she never thought she'd get it. She thought, well, he served, I didn't. Well, if you really think about it, she served too. She kept the home front going. The kids were being reared. You had people working in the factories and making sure the country kept moving. And at a time like we're talking about, those heroes are out there. It's those unsung heroes that we're praising right now, but you really see what they're doing. You feel what they're doing. Well, we had that in the Great Generation as well. And they did a lot for us to keep things moving, so that our military men and women could serve honorably for us.
When you say wartime service, I know that that can be a little confusing, and that people should not um, should not just think that they know exactly what that means, because there might be
Mhm.
dates that qualify them that they're not aware of. Could you address that a little bit?
Sure. So a wartime veteran, they have to have served at least 90 days of active duty service with at least one during active war. The key thing we run into is people aren't really quite sure when the declared start or declared end of war was. So you take World War II for example. We've had a lot of veterans. They would say, well, World War II ended in 1945 because we had VE Day and VJ Day where they were signing those documents. But then when you really look at it, it actually didn't end until the end of 46, 1946. So we actually had veterans that, frankly, they got in and their service had actually started in 1946, but they never thought that they were eligible
Wow.
because they figured, well, VE Day, they signed all this, but we still had veterans occupying in Japan and other parts of the world. And frankly, the bullets were still flying. So I always figure it's best to just ask the question, and we'll answer it. And if the dates fit, we do know what they are. It's just someone making sure they have a copy of their DD 214, which is their discharge paper. A
Okay.
lot of the veterans have those, but some through moves and life, right? They may not have some of those documents, and they can give us a call. We can help them get a request in as well,
Okay.
or even the kids. We work with a lot of the kids of the veterans because they need to, when we're talking about long-term care, we call it the discussion. Parents and their children need to be having that discussion of, well, who's going to do what? Who's helping us care? Who's going to take care of the finances? Who's going to take care of we got a lot of nurses and stuff out there that are taking care of their parents. Well, can they be paid for that or not? Does that work with a long-term care insurance policy? Or if there's a veteran, could they be paid? Well, that helps the family out. It helps the whole family out in that they're getting a loved one that truly cares for them. They're able to help them out. And heck, a lot of time the parent's the one that paid for all the nursing school, right?
Right. So what kind of care can an adult kid maybe get paid for? Are you talking about when they are like providing full-time care in the home or overnight care, or can it be helping them out to the extent that they're, lining out their medicine for the week and they're running all the errands for them, they're getting them to all the doctor's appointments and making all the phone calls? Like, at what point?
Sure, it's really kind of like what you'd see a home care agency doing, and you have a lot of the kids are doing that in an informal way. Well,
Okay.
even with like say that veterans benefit I was discussing, they look at, well, you helping with things like activities of daily living,
Okay.
so dressing and bathing, transferring, continence, or if someone's got dementia or Alzheimer's, so even cognitive issues. And you have a lot of folks where they can, they can still kind of live on their own. Dementia, it's not, it hasn't progressed fully yet, but they're needing help. They're forgetting certain things.
Mhm.
Maybe they're going to forget to turn the stove on or off, right? Turning it off. So, or helping, like you had mentioned, hey, we need to line up your week's medications. So those can actually be considered things that they could be paid for and count towards potentially qualifying for that benefit for a veteran. And even some long-term care insurance policies that we've sold over the last 26 years, they will actually pay for informal caregivers like that. Because frankly, like all of us, having a stranger coming in or having a daughter or even a granddaughter or a grandchild coming in, that's some of us are just going to be more comfortable because the person coming in your home. Not that anyone's doing anything wrong, or some of these home care agencies just do some wonderful work out there, but it's a comfort level. You're working with a very independent generation when you look at those in which are needing most of the care, that are in their frankly mid 70s and 80s.
Mhm.
So
Well, and for some people too, their kids are helping them up to the point that they start bringing in the in-home care and the home health companies, and then the kids still are involved in helping out, for
mhm.
sure. So
Yeah.
it's all hands on deck a lot of times, just helping people with the issues that they have. And certainly, um, boy, I don't think I'd want to be an adult kid trying to manage all of these insurance topics that you're talking about without getting some help. So that's a tremendous
Sure.
service that you provide. So, so Medicare starts when people are 67 and 68. Is that right?
No, so Medicare when someone's turning 65. So when
Okay.
someone's turning 65, they have a 7-month window to get themselves set up if they're going to choose to go on Medicare A and B. Because some people, like we had mentioned, they're going to keep working, so they've got group health insurance. Well, Part A will typically turn on automatically. So when you're
Okay.
turning 65, it should start on the first day of the month of your birth. So if your birthday was, say, May 30th, you're actually going to start Medicare A would actually turn on for May 1st.
Okay.
And if you wanted to get Part B set up, you can enroll in that online. That's why I did advise earlier. You want to get a Social Security website set up. When you're turning 65, the easiest way to get enrolled in Medicare is to go online.
And
You can enroll it through there.
do you need to wait till you turn 65 or?
Nope, you want to actually get things started 3 months before, if at all possible. So that 7-month window I mentioned, you have 3 months before your birth month, the month of birth, and then 3 months after, and that would be what's called your initial election period. So that's your 7-month window to get everything set up. Most are going to get everything, you want to get everything done about 3 months before, so that gives that first month, time for Medicare to get everything done and then get cards and everything out. And then you're able to really shop and think through which insurance is a better option, the supplements or the advantage plans I'd mentioned earlier. Because, you can just do A and B, original Medicare. However, the downside is who wants to be on the hook for 20% of the all bills? You want to get something additional, whether it's the Medigap and supplement, or if it's a Medicare Advantage plan to cover your 20% up.
Okay, so that Part C is Advantage plan or supplements.
Well, Part C is Medicare Advantage plan. It's
Okay.
one of those insurance options. That's Part C. And Medicare supplements, just like kind of it sounds, it supplements Medicare. It pays after Medicare pays. So Medicare pays its 80%, and then whatever supplement company, there's many different letters of that alphabet, so we don't want to I won't confuse everyone there. But that's going to supplement and pay what Medicare didn't pay, depending on which one you've got. We'll decide how that pays. But that's how you would cover up your 20% there. Or you go with a Medicare Advantage plan, which pays instead of Medicare paying. So it's one pays after Medicare, and then the Medicare Advantage actually becomes your primary if you choose that as an insurance option. But keep in mind, you're always on Medicare, because you're not going to get either one of those options if you're not on Parts A and Part B. So you've got to have both of them to get that option.
What kind of cost is involved when people are implementing the B and then adding on the C and D?
Sure. So Part B is right now, it's $144.60 a month,
Boy,
and
I'm
that'll
learning.
go up. And that can go up a bit each year, and it typically has gone up. And then you've got Part B has a deductible of $198 right now. And once
Okay.
again, those costs tend to go up as well. So a Medicare supplement it's going to vary depending on company, and it can vary quite a bit. But someone that's looking at this is Plan G. G as in Gary is going to be one of your more common plans that you're going to see out there now. The difference between one company and another is really the cost and their premium.
Okay.
They're all going to pay the same way from one company to another because they're standardized. Medicare says, well, we paid our 80%. You are all a Plan G. You've got to pay all the same way. The key difference is how much is that person paying in premium to have that company. You want to have a solid company. You don't want just a fly-by-night or someone that doesn't have a good rating, can't pay their bills, obviously. But the rest of them, they're all going to have to pay the same. Your Medicare Advantage plans will be a little different. They compete on copays. So the copay could be a little different. Maybe if on one plan to see your doctor, you'd pay $5 or $10. You know, if you're seeing a specialist, maybe you're paying $25 to $45. But it's more of a pay-as-you-go system. So
Okay.
the Medicare supplement you pay monthly, and it doesn't matter really how many times you went. The Medicare Advantage, a lot of our clients would say, well, we'll save that extra premium we would have been paying, and we'll just use that to cover any of our copays as they came up for the year.
Very good. Well, um, the mud is becoming a little less thick. So we appreciate this, and we help more and more people find you and people like you that can help navigate through all of these questions and help them with, certainly right now with the COVID-19 job changes, help them through that. So
yeah. Well, and for your viewers here is if they've got any questions that they'd like to have answered on any of these topics, submit them out here to Katherine, and we may just do a follow-up and just so we can answer some of those questions for those folks. As we may have answered some here, right? But it's a maze of different things, and everyone's situation's individual. But people could submit some of those questions to you, and we can, in a sense, perhaps do a follow-up together on some of that. So we're answering some very direct questions for your clients out there.
Thank you. That's a great idea. So please send us your questions, and we will do some follow-ups. And if we get enough, maybe we'll do a television episode on it. I think that this could be really helpful. So Mark, thank you so much. We appreciate having you on Empowering Seniors, and we'll look forward to the next time, Mark.
Absolutely, Katherine. Thank you for having me.
You have a great day. I'm going to end the recording, and I'll get a little more information from you, and then we'll be good to go. All right. Thanks
Excellent.
a lot.
Thank you.